Hello and welcome. This presentation is a part of the series, A Guide for Parents of Children in West Virginia Public Schools. Today's presentation focuses on children who have experienced trauma. The following information was collected from a handout from the Child Welfare Information Gateway website. The goal of this segment of the series is to help parents better recognize trauma and, in turn, help their children cope after trauma. Let's talk about what is actually meant when the word trauma is used. Trauma is an emotional response to an event that threatens or causes harm. The harm can be physical or emotional, real or perceived, and it can threaten the child or someone close to him or her. Trauma can be the result of a single event, or it can result from exposure to multiple events over time. Examples of traumatic events include, but are not limited to, abuse, be it physical, sexual, or emotional, neglect, effects of poverty such as homelessness or not having enough to eat, being separated from loved ones, bullying, witnessing harm to a loved one or pet, example, domestic or community violence, natural disasters or accidents, unpredictable parental behavior due to addiction or mental illness. Trauma can affect children's bodies by causing the inability to control physical responses to stress, and it can lead to chronic illness even into adulthood, such as heart disease or obesity. It can affect children's brains and thinking, causing difficulty thinking, learning, concentrating, and impaired memory. Trauma also causes difficulty switching from one thought or activity to another. Trauma can have a negative effect on emotions or feelings. It can cause low self-esteem, the feeling of being unsafe, an inability to regulate emotions, a difficulty forming attachments to caregivers, trouble with developing and maintaining friendships, and trust issues and depression and anxiety. It can have an effect on behavior, including a lack of impulse control, fighting, aggression, running away, substance abuse, and/or suicide. In many cases, a child's body and brain recover quickly from a potentially traumatic experience with no lasting harm. However, for other children, trauma interferes with normal development and can have long-lasting effects. Factors that determine the impact of traumatic events include the following. Age. Younger children are more vulnerable. Even infants and toddlers who are too young to talk about what happened can retain lasting sense memories of traumatic events that can affect their well-being into adulthood. Frequency. Experiencing the same type of traumatic event multiple times or multiple types of traumatic events is more harmful than one single event. Relationships. Children with positive relationships with healthy caregivers are more likely to recover. Coping skills. Intelligence, physical health, and self-esteem help children cope. Perception. How much danger the child thinks he or she is in, or the amount of fear the child feels at the time, is a significant factor. Sensitivity. Every child is different. Some are naturally more sensitive than others. The age of the child can often determine the symptoms they experience from trauma. Young children, ages 0 to 5, are known to experience irritability or fussiness, startling easy, or being difficult to calm, frequent tantrums, clinginess and reluctance to explore the world, a change in activity levels much higher or lower than that of their peers, repeating traumatic events over and over in dramatic play or conversation, and delays in reaching physical, language, or other milestones. School-aged children, those aged 6 to 12, often show symptoms of trauma as difficulty paying attention, being quiet or withdrawn, frequent tears or sadness, talking often about scary feelings and ideas, difficulty transitioning from one activity to the next, fighting with peers or adults, changes in school performance, wanting to be left alone, eating much more or less than peers, getting into trouble at home or school, frequent headaches or stomach aches with no apparent cause, behaviors common to younger children, such as thumb sucking, bedwetting, or fear of the dark. Teenagers, or those aged 13 to 18, who have been exposed to trauma often experience talking about the trauma constantly or denying that it happened, refusal to follow rules or talking back frequently, being tired all the time, sleeping much more or much less than their peers, nightmares, risky behaviors, fighting, not wanting to spend time with friends, using drugs or alcohol, running away from home, or getting into trouble with the law. When faced with a trigger, depending on whether the child has a fight, flight, or freeze response, the child may appear to be throwing a tantrum, willfully not listening, or defying you. However, responses to triggers are best thought of as reflexes. They are not deliberate or planned. When children's bodies and brains are overwhelmed by a traumatic memory, they are not able to consider the consequences of their behavior or its effects on others. Now that you know what trauma is and the effect it can have, you may feel a little helpless. Do not worry, though. There are several ways you can help a child who has experienced trauma. The first important step is to identify the trauma triggers for your child. What distracts your child, makes them anxious, or results in a tantrum or outburst? Help your child avoid these triggering situations, at least until they have healed more. The second step is to be emotionally and physically available. Provide attention, comfort, and encouragement in ways your child will accept. Younger children may want extra hugs or cuddling. For older youth, this might just mean spending time together as a family. A third step is to respond rather than simply react. Your reactions may trigger a child who is already feeling overwhelmed. Some children are even uncomfortable being looked at directly for too long. When your child is upset, do what you can to keep calm. Lower your voice, acknowledge your child's feelings, and be reassuring and honest. The fourth step in helping a traumatized child is to avoid physical punishment. This may make a traumatized child's stress or feeling of panic even worse. Parents need to set reasonable and consistent limits and expectations and use praise for desirable behaviors. Praise and rewards for positive behavior can include hugs if the child is comfortable with this, high fives, saying "great job," attention, a trophy or badge, or extra time doing a favorite activity. Step 5 is to listen. Do not avoid difficult topics or uncomfortable conversations, but don't force children to talk before they are ready either. Let children know that it's normal to have many feelings after a traumatic experience. Take their reactions seriously, correct any misinformation about the traumatic event, and reassure them that what happened was not their fault. Step 6 is to help your child learn to relax. Encourage your child to practice slow breathing, listen to calming music, or say positive things such as, "I am safe now." Step 7 is to be consistent and predictable. Develop a regular routine for meals, playtime, and bedtime. Prepare your child in advance for changes or new experiences. Step 8. Be patient. Everyone heals differently from trauma, and trust does not develop overnight. Respecting each child's own path of recovery is important. Step 9. Allow some control. Reasonable, age-appropriate choices encourage a child's sense of having control of his or her own life. Step 10. Encourage self-esteem. Positive experiences can help children recover from trauma and increase resilience, or the ability to bounce back from a negative experience. Examples include mastering a new skill, being part of a community, group, or cause, and setting and achieving goals, and helping others. If your child's symptoms still last more than a few weeks, or if they are getting worse rather than better, it is time to ask for professional help. Quick, effective mental and behavioral health interventions may help in the following ways. They can increase your child's feelings of safety, teach your child how to manage emotions, particularly when faced with trauma triggers, help your child develop a positive view of him or herself, give your child a greater sense of control over his or her own life, and improve your child's relationships with family members and others. A recent study finds that severe childhood trauma and stresses early in parents' lives are linked to higher rates of behavioral health problems in their own children. Also, learning about what your child experienced may even act as a trigger for you, especially if you have your own trauma history that is not fully healed. Being affected by someone else's trauma is sometimes called secondary trauma. There are physical, behavioral, emotional, and cognitive symptoms of secondary trauma. Physical symptoms include headaches, stomach problems, sleep problems, weight gain or loss, and lack of energy. Behavioral symptoms of secondary trauma can look like increased drinking or smoking, procrastination, feeling overly critical, and avoiding other people. Some common emotional symptoms are anxiety, frequent crying, irritability, loneliness, and depression. Cognitive symptoms of secondary trauma exposure are inability to concentrate, forgetfulness, loss of humor or fun, and the inability to make decisions. The best cure for secondary trauma is prevention. In order to take good care of your child, you must take good care of yourself. Here are some things you can do. Be honest about your expectations for your child and your relationship. Having realistic expectations about parenting a child with a history of trauma increases the chances for a healthy relationship. Celebrate small victories. Take note of the improvements your child has made. Don't take your child's difficulties personally. Your child's struggles are a result of the trauma he or she experienced. They are not a sign of your failure as a parent. Take care of yourself. Make time for things you enjoy doing that support your physical, emotional, and spiritual health. Focus on your own healing. If you have experienced trauma, it will be important for you to pursue your own healing separate from your child. Seek support. Your circle of support may include friends, family, and professional support if needed. Don't be afraid to ask about resources available from the child welfare system, such as a caseworker or support groups. Hopefully, in this presentation, you've learned some useful information to help your child and possibly yourself cope with a traumatic experience. The resources that were used in the creation of this presentation, along with some extra resources for learning more, are listed on this page. Thank you.